commonly believed that we have no idea what causes most cases of low back pain. Take this 2017 review article, for instance, which explicitly states that non-specific low back pain has no known pathoanatomical cause. Well, this is false. We have excellent evidence dating back to the 1950s that most cases of low back pain arise from disc pathology, either directly or indirectly. Let's start with consideration of pain arising from the disc itself. The outer 1 or 2 millimeters of the disc, called the annulus fibrosus, has nerve endings from the sinovertebral nerve, which, when irritated, can cause pain. And this ability of discs to cause pain when irritated has been known for at least 70 years. This paper by a Swedish surgeon was published in 1949. It documents a case series of 200 patients he operated on while awake. He used local anaesthetic to provide pain cover to the tissues overlying the discs, meaning he was able to expose the discs themselves without anaesthetising them or numbing them. After exposing the intervertebral discs, he probed the outer disc, in his own words, somewhat firmly, to assess the resultant pain response, all while the patients were awake. And in almost all of the 200 cases, he was able to generate low back pain in what was described as a lumbosacral distribution. In other words, irritating the outside of the disc caused non-specific low back pain. It documents a series of case studies in which nylon thread was passed through and around various anatomical structures in the spine, with the free loops left protruding from the skin, then covered by a sterile dressing. In one of the patients, this nylon was looped through the annulus fibrosus of the L4-5 disc, the outer part of the disc. Then, the day after the operation, the investigators tugged on the nylon loop, and after about 30 seconds of continuous traction, the subject described an ordinary backache. In other words, something akin to non-specific low back pain. We then have this paper from 1991. A series of 193 patients were again operated on while awake, using local anaesthetic for analgesia. First, the investigators exposed the tissues of interest, and then, before numbing them with local anaesthetic, they used blunt compression and electrical stimulation to assess the pain response. The major finding was that the outer disc, the annulus fibrosus, was implicated in low back pain. In 2/3 of the nearly 200 subjects, stimulation of the annulus fibrosus always reproduced their pre-operative pain. Not just caused pain, but qualitatively reproduced their pain. The subjects identified the pain produced on irritation of the annulus as being identical to their usual low back pain. Clear evidence that much so-called non-specific low back pain is actually discogenic.
Annotated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.